This is a short presentation on how to take good clinical photos. Firstly, get someone else to take the photo. You'll virtually always get better pictures if the photo is not taken by the patient. For clinicians taking photos, consent forms are only needed if you would like to use the photos for anything other than direct patient care, such as teaching or posting on the internet. A suggested consent form can be found on the PCDS website or by following the QR code below. Photos look much better if they're taken with the main camera on a phone rather than the selfie camera. Switch between the main camera and the selfie camera. Tap on the screen to focus the camera. It's very important to get the light right. Make sure the skin is well lit, and soft indirect lighting is best if you're indoors. Best of all is bright natural light, being careful not to cast a shadow. The flash may help to eliminate shadows, but it may also cause whiteout or light the area unevenly unless you have a professional setup. So in general, if using a phone to take the photo, it's usually best without the flash. You may need to experiment to get the best lighting. Place the area to be photographed on a plain background, such as a plain towel, sheet or wall if possible. Ideally, this should be a neutral colour, such as grey or light blue, because a white background can cause the photograph to be too dark, and a black background can cause it to be too light. Whatever body part you're photographing, rest it on something to hold it still. You're going to need to take at least 2 photos, an orientation photo of the whole area affected, and the other side if possible. The orientation photo is to show where the problem is and how big an area it covers. Try to show the whole area affected if it's a rash, including both sides of the body. If you just send a photo of one elbow, we don't know if that's because only one elbow is affected or because both elbows look the same. By showing both elbows, we can see in this case that the rash only affects one side. If photographing hands, please take photos of both hands, front and back. You're also going to need a close-up photo or several of them. And if you're a clinician, dermoscopy photos can be very helpful. And this QR code takes you to a link to talk more about how to take good dermoscopy photos. For the close-up photo, use a coin or a ruler to give an idea of scale. For a raised lesion, you're going to need extra close-up photos to show it from the side as well. Focus is more important though than getting really close up. In these pictures, the phone camera is too close to the skin. If you get too close, the camera may not be able to focus. Standing back is better. You can always zoom in. If you're using a digital camera to take the photo and it has a macro mode indicated by a little flower, then you can select this and get closer to the skin and still get a focused picture. This is the same photo, just cropped to zoom in. If you have it in focus, you can either zoom in before taking the picture or send it as it is, and the person receiving the photo can zoom in. It's really helpful to be able to tell if a seemingly flat lesion is truly flat or not, and having the light coming from the side can be very helpful for this, as in this case. And here's another example. Take lots of photos and have a look at them. Only send the best ones. The photo that you send needs to actually look like the skin lesion. File size of images is important. If you have the option to resize to around 100 kilobytes to 500 kilobytes file size, this is ideal. For clinicians taking photos in apps, the app will usually resize them for you. We have a separate short presentation on how to use the Pando app, but remember, you can always take photos on the patient's phone and transfer them into the notes in the normal way, usually via Accurate's or the Practice website, and many areas will use other apps. For patients taking photos, please be aware that all photos are stored in clinical records. If you're not happy for them to go in your notes, then please do not send them in. It's good practice for clinicians to show the pictures they've taken to the patient before uploading them to the notes. All of this information is available on the PCDS website using the links below.